This is the chest X-ray of 70-year-old male with increasing confusion. He has a productive cough and a fever. He has a past medical history of hypertension, angina, and mild cognitive impairment. He has a last 45-year smoking history. On examination, he has saturations of 89% in air and is febrile with a temperature of 38.8 dGC. There is dullness to percussion and coarse crackles in the right upper zone. A chest X-ray is performed to assess for possible pneumonia or collapse. This is the chest radiograph. Now you can see on this radiograph there is heterogeneous airspace opacification in the right upper zone. This has a relatively well-defined inferior margin, which is likely to represent the horizontal fissure. There is a focal area of increased opacification in the right upper zone, which may represent focal consolidation or an underlying mass. The remainder of the lungs are clear. The lungs are not hyperinflated. The pleural spaces are clear, normal pulmonary vascularity. The upper trachea is central. The lower trachea is displaced to the right by the aortic arch. The heart is not enlarged. The heart borders are clear. There is unfolding of the thoracic aorta, which displaces the lower trachea to the right. The mediastinum is central, not widened, with clear borders. There is a well-defined density projected over the lower mediastinum, which is in keeping with a hiatus hernia. Normal size, shape and position of both hilar, normal appearance and position of hemidiaphragms, no pneumoperitoneum. The image skeleton is intact with no fractures or destructive bony lesions visible. Initial blood tests like full blood count FBC, urea and electrolytes, blood cultures and C-reactive protein. Additionally, a sputum culture may be collected for further analysis. The patient should be treated with appropriate antibiotics for community-acquired pneumonia and a follow-up chest X-ray performed in 4-6 weeks to ensure resolution. If the focal opacity in the right upper zone does not resolve, then a CT of the chest and abdomen with IV contrast would be appropriate to assess for a lung tumour. So this is the case of right upper lobe consolidation. Here, this X-ray demonstrates heterogeneous right upper zone consolidation in keeping with pneumonia. The consolidation has a relatively abrupt inferior margin in keeping with the horizontal fissure, indicating this is right upper lobe pneumonia. A focal opacity in this region may represent focal consolidation or a mass. Incidentally, there is also a hiatus hernia.